Welcome back to Insight. I'm at Indiana Physical Therapy, joined by Troy Smith, and we are talking about why people should come to Indiana Physical Therapy, a private physical therapy practice, rather than perhaps like going to the hospital for physical therapy. It's really more cost effective, isn't it?
Right. Our market analysis shows that reimbursement rates for hospital systems range from 150% to upwards of 250% higher than what a private practice entity would receive. So that translates to typically lower co-insurance, co-payments to the patient for each visit.
We talked about, or we have talked about too, you guys are really good about making it work for the patient.
Right.
Whether that's scheduling, making it
Right.
work for the patient, and not over scheduling them. You're going to have them come as many times as they need. You're also going to give them stuff to do at home, so they're not coming when they don't have to come.
Correct. Again, comparing our average numbers of visits per a specific diagnosis, comparing to state and national averages through databases that we participate in, we're finding that our average length of stay, our average number of visits is 25, sometimes even 30% lower than those national or state averages, which again translates into fewer co-payments, which is cost savings for the patient and the insurers.
I think that's really important, and I think it speaks to the fact that you guys are about making people well, not about making yourself lining your pockets, or it's about you want to make people feel better.
From the start, back in 1988, Dave and Andy, and when I joined later on, our motive was to get people better as fast as we can, and that translates into fewer visits. We actually, strongly encourage participation in a home program, because that's going to continue care when patients are away from us, again translating into fewer visits.
That's what, when we talk about, we talk to your different therapists, they're always giving us ideas to tell people at home to do.
Right.
We do those little tips with you guys that we run on the air, giving people ideas of things to do at home to stay healthy. And that's really what you want to do. You want our community to be healthier.
Yeah. In today's market, insurance changes, healthcare changes, everybody's becoming a more knowledgeable consumer, and we encourage people to do that, participate in that manner, because cost savings to them is cost savings to the insurer, which hopefully will translate into lower premiums down the road.
If somebody does need physical therapy, let's talk just a little bit. I feel like we've talked about it a lot, but I still think there's people that don't know the direct access thing. People don't have to have a physician's prescription anymore in Indiana to come and see you.
That's correct. Starting July of 2013, an individual can seek out the consultation and treatment from a physical therapist without first going to their physician. Now, that doesn't always mandate insurance payment, but it allows that client, potential client, to seek our expertise without first consulting with their physician. And individuals who do that, we also will find out who their physician is and relay information that we obtain in that evaluation or assessment back to that physician.
I think it's so important too, because there are so many people now that do direct pay, that don't go through their insurance for things that really makes a big difference to them if they don't have to go to their physician first before they come to you guys.
It gives the patient the option. Yeah.
Let's talk to, I've mentioned it before, you guys have so many locations and make it so convenient for people.
Yeah, as we've grown since 1988, we've basically grown by invitation, whether it's a referral source, an underserved community, neighborhood. We found that by getting closer to the people, extended hours, weekend opportunities to get treatment, lends itself to a certain level of convenience that patients embrace and will seek us out, because we're basically path of least resistance. We'll get them better faster, and we're right there in their back door, and we're convenient hours, before or after work.
Well, and that's just it. When you need to come more than once, when you
Right.
need to come on a routine for a little while, it makes it so much easier when you can do it on your way to work, on your way home, maybe on your lunch hour,
Exactly.
or just around your schedule. So convenient locations, you make it easier for us. You don't make us come more than we have to. So
Right.
Indiana Physical Therapy is the place to go when you need physical therapy. Visit them today. Give them a call to find out which one of their locations is easiest for you, or visit them online. We'll be right back on Insight. Welcome back to Insight. I'm with Dave Kuhn, one of the owners here at Indiana Physical Therapy, and we're going to talk today about patient choice. We talk about direct access and how since July of last year, I almost said 2012, but really that would have been 2013.
It was 13, right?
Time flies when you're having fun.
Does it? And this has been a fun year for us.
It has been a fun year here. You guys keep growing and keep doing more and more. And direct access means that patients can come without a prescription. But really there are some things that people need to know, that when they have a prescription for physical therapy, they still have a choice, don't they?
Exactly. I think what we're seeing now, especially in today's medical conditions, the people are becoming better medical consumers. And so when a doctor writes you a prescription for medication, you can choose whether you want to go to the big box store and get that filled, or whether you have a local pharmacy that you really like. Again, it's the same medication, and you can choose where you want to go. That same principle applies for physical therapy. When a doctor writes you a prescription for physical therapy, you decide where you want to go. And like I said, as people become better medical consumers, they're looking for, where am I going to get better? Where do I have the most confidence that I'm going to improve my condition? Where is it easier for me to go to physical therapy? Is it close to my house, close to my work? What are the hours? And then what are the costs? So I think people are looking at, the quality of care, the location, the hours, and the cost. And so they get to choose where they want to go.
And you can become a better educated consumer in a variety of ways. Obviously, you can ask your physician, and I know when I had a rib out of place, my physician said to me, you have to go see Steve at Indiana Physical Therapy.
Right.
He's the only physical therapist,
He's
I
the best
think,
at rib care.
that can put your rib back in place. So obviously, physicians are going to have some opinions. You can ask them, but you can also go to a website. They can go to your website and they can research. There are ways that people can become better informed, aren't there?
Exactly. You can, go to indianapt.com, look at our website. We've got lots of resources for people to look at, but also talk to people who have been engaged in physical therapy. Talk to physicians, and even we welcome people to come in here, talk to us. Look at what our environment is. Do you feel comfortable here? If so, choose us.
That's important to know, because you do want to feel comfortable.
Exactly.
You're having people work on you. You're not in you're just, I don't want to say a weak position, but you're having somebody work on you, so you want to be in a comfortable position.
Physical therapy is recognized as a high-touch, lower-tech medical profession. People are touching you. You want to be comfortable with someone who's going to touch you. So, are you comfortable with the environment? Are we professional? Is it discreet enough that if we have to expose some of your skin or body, do you feel like you're being exposed to the whole world, or do you think that we've respected your privacy?
I like the rib thing. I always felt like I was getting a little bit of a shoulder massage.
I bet. Until he pushed on it. Right?
Well, yeah, but could I have some of that done again, please? I'm begging you. You did talk too about the locations, and I think that's something that's very important that makes you stand out, is you do have a lot of locations that make it very convenient for people.
And we've done that for a reason, because people have told us, man, I love coming to physical therapy. You guys are the best, but I have to drive 30 minutes, or I work up in this area and I live down here. And so over the last 25 years, we've kind of responded to where people want us to be. So we have 12 locations. We're open 7 a.m. to 7 p.m. So you can see us before or after work. So I think that's one of the reasons, you asked me earlier, why would they choose Indiana Physical Therapy? I think, our locations, our hours, and again, our expertise.
And your expertise, let's make sure people understand, your expertise really spans across a wide variety of things. We said something about Steve being the best when it comes to ribs. You have people who are the best when it comes to hands and feet, and you really span across speech therapy. You really go everywhere, don't you?
That's probably what, as the owners, Andy Smith Andy Vogel, Troy Smith, and I
He changed his name.
are the most proud of the quality of the education that our people continue to pursue. We have lymphedema specialists, and we have people who just specialize in ribs and headache and neck. So we do have people who have committed themselves to lifelong learning, and I think that's what sets us apart. Is that we're not just satisfied with how we're treating patients today. We want to make sure that we are evidence-based and up to the minute in the latest techniques.
And that's really important. So you have the best therapists who are up to date in their education and are on all these different locations, which really make it convenient for everybody. So it makes sense why you should ask your physician for that prescription to come to Indiana Physical Therapy and make that choice for yourself today. For more information, you can visit their website, indianapt.com, or give them a call today. We'll be right back on Insight. Welcome back to Insight. We're at Indiana Physical Therapy. I'm here with Andy Vogel, one of the owners, and we're going to talk about direct access. We've talked about this a lot, but I want to make sure that people understand it. So July of last year, 2013, Indiana passed a law that said people don't have to have a prescription from a doctor now to come to a physical therapy place.
Yes.
A facility, that's a better word. So tell people what that means, because it doesn't mean exactly that they can just walk in.
Basically it does, though. However, there's a few things that you have to consider. Is even though that a person has the ability to walk directly into a physical therapy facility now, it's still the idea of payment.
Right.
And some insurance companies do not allow that. Some insurance companies do. So it's always prudent for the consumer to check with their insurance company. We would do that, obviously, if somebody were to walk into one of our clinics and request services. And that's, if they don't have insurance, we don't deny them those services, but it's smart for the consumer to check on their own insurance to find out.
So really, you can come in, you can get treatment, it's just going to be whether or not the insurance would pay for it.
Yes.
And of course, you guys, I've been a patient here before, you guys are going to go through my insurance and tell me, okay, your insurance is going to cover for this condition, mine was a rib issue, your insurance is going to cover this many visits, and it covers this much, this percentage. So you're still going to do that whether I come in with a doctor's prescription or without.
Yes, exactly. With the procedures for as far as payment are exactly the same whether you have a prescription or not. There's a few restrictions in the direct access laws, and one of those is that we can only treat a patient for 24 calendar days before they have to have a prescription. And that works out closely with, hopefully we'll get them better before that time, but if not, then we'll just contact their family physician, who we will be in contact with from the initial evaluation of that patient as well, sending him or her the information on that patient, on their patient.
And I was just going to say, it's not as if there was an adversarial relationship between you and physicians. So you're still going to be in contact with the doctors, and if somebody came in and you thought to see a physician, you're absolutely going to tell them to go see their physician.
Yes, that's one of the reasons why we were granted direct access, is because it was determined that as a profession we can make that determination if somebody would need to see a physician. It's not just I'll treat anything. If it's bleeding or broken, we can treat it. No, that's not the case. But what direct access does is it allows the consumer to have an entry point into the system, especially to an area of medical expertise like we have with outpatient orthopedics.
I think the great thing too is for somebody who has been here before
Yes.
and who knows, okay, I know my rib's out of place again. I know what it felt like the first time. Now I don't have to go back to the doctor first.
Yes.
I can just come back and see you and have those, however, few visits I need to get myself back
Exactly.
to working condition.
And from the standpoint, that'll save the consumer money too, because there's fewer steps and it's quicker into the system. They don't have a wait. potentially.
I think the other thing too is you said you can see them for 24 days, and we've talked about this before. You guys are so good about creating the home programs and doing the things so that people don't have to have unnecessary visits.
Right.
So a lot of times you can create those programs or get somebody on their road to recovery within that time frame, and really get them feeling better if it's a minor problem.
Even if it's not a minor problem, everybody that leaves this clinic, one of our clinics, has a home exercise program. If it's a chronic condition or an acute condition, there's always something that they should be doing for themselves at home. That way, that facilitates the whole healing process. They buy into it, and they're responsible for their own care. And nowadays, people are becoming smarter consumers, and they want that. They don't want somebody just to tell them what to do and do it for them. They're an active participant. That's why it's called physical therapy. They are actively participating in the clinic as well as at home.
Very important. Let's tell people what if they want to participate in direct access. If they want to come in and see you, is it just as simple as making a phone call, going online, finding the clinic that's closest to them?
Yes, it is. That's one of the reasons why we're located where we are, nearest to the population bases as we can. Hopefully they'll be able to find a clinic that's convenient for them, or if not, they can just call the main line, and we might be able to help them out with the clinic that is closest to them.
All right, and of course the convenient hours mean that you probably can get them in perhaps fairly quick, especially if it's something that they're in a lot of pain.
Exactly. If they're in an acute situation where something's fired up and irritated, we're going to try to get them in within 24 hours.
All right. Well, if you are and you would like to come directly to the physical therapist, just give Indiana Physical Therapy a call today. Visit them online, indianapt.com. We'll be right back on Insight.